Good morning. Testing, testing, testing. Good morning. Testing. Okay. So everything is working. No technological glitches. Today is Saturday, June 4th, 2022. This is our scheduled Saturday morning yoga therapy classes. I'm here after a long time, and many of you may know through my Facebook posting that I had the second COVID-19 booster, and following that, I had a dry cough and hoarseness of my voice, all from laryngitis, which lasted over 3 weeks. I'm a compliant patient. I've seen my physician. He has checked me out, undergone everything, including a COVID-19 test, which was also negative, but really took out some time. I'm still not, as I said, completely well, but nothing I can do. It is just like a dry cough. There is nothing in the lung, not productive. There is no systemic sign of any illness, no fever, nothing, no other symptoms except here, the laryngitis. So today's topic is, let's see, what is here? Okay, yeah, today's topic is going to be yoga therapy, the finding center. What does it mean? Again, as I said, we all talk about from our experience. And our experience is that the total health benefit of yoga comes from the balance. In yoga, the health is defined as a balance of your body, mind, and spirit. And as you noticed all the time, we do for a daily practice a tremendous number of balancing asanas, balancing pranayama, balancing meditation, and in a daily routine, we have incorporated the balance in our daily activities. The finding center means, okay, let me go back again. The root cause of all our endogenous disease. Endogenous disease means disease comes from within us, not an external source, like lifestyle-related diseases, like diabetes, hypertension, coronary artery disease, high cholesterol, osteoarthritis, osteoporosis, and the real source of disease is the imbalance of both sides of your brain. I'm right-handed, right-footed. I'm all the time using my right foot and right hand. A Ayurvedic concept, it is called the law of attraction, and this is also called the gunas, the attributes for the doshas. Doshas are your psychophysical body type, Vata, Pitta, and Kapha. Ayurveda recommends law of opposite. That means if you're right-handed, right-footed, try to use your left hand and left foot most of the time, and then eventually you'll get into in the center. So I'm going to show you the practices soon. How do you bring the center in your practice, and how to bring up and practice yoga as a therapy for your daily, day-to-day activity. Now, for example, in our daily routine, first thing we do, we wake up in the morning. Even during sleep, we generally sleep on our left side in a fetal position. But at the beginning, we sleep like a baby, called laying down closed angle asana, Supta Baddha Konasana. Then you lay down initially on the right side to the left side. And I have described all of them in the sessions I have done for yoga therapy for insomnia and sleep apnea. And also most of your practices where I show how to sleep. So get up in the morning, we sit down in the squatting pose. A squatting pose also a perfectly finding a center. This is a squatting pose, or called malasana. And you can see here that go a little bit in the back so you'll be able to see better. Here, that right foot is grounded, left foot is grounded. It is relaxed, ankle is relaxed, knee is relaxed, hip is relaxed. Put my hands, separate my fingers, and get a relaxation. First, we sit down and drink 1 or 2 glasses of water at the room temperature, and we swallow in a gulp. And I'm in the center. I'm balancing both sides of my body, put my hand, separate my fingers. This literally relaxes my hand. Extend my wrist. This is going to relax my wrist. Put my one elbow and other elbow inside. Slowly bring my hand close to me. Keep my spine straight, eyes closed, and I'm breathing out longer than breathing in. My focus is on both the nostrils and consciously and subconsciously I am trying to breathe through both the nostrils equally to find the center. Left nostril is controlled by the right brain, right nostril is controlled by the left brain. Able to breathe equally on both the nostril brings the center and makes both half of the brain functioning properly. For the practice, we will do a alternate nostril breathing, or called Anulom Vilom Pranayama. This is to activate your gastrocolic reflex, to have a smooth bowel movement in the morning. To sit down in this malasana after drinking a comfortable amount of water, 1 or 2 glasses, then you will see you will have a urge to have a bowel movement. If you don't have that bowel movement initially, you can do what is called a Laghu Shankha Prakshalan. And also remember, your function of the gastrointestinal tract is through parasympathetic activation. Parasympathetic is called calm and digest. Laghu means mild. Shankha is a metaphor of your intestine, and prakshalan means cleansing. 5 asanas, but one asana which brings you in the center is called your Shankha asana or Udar Karshan asana. Shankha is again a conch shell, it's a metaphor for your intestine, and Udar Karshan. Udar means your stomach, Karshan means your massaging your stomach. So you hold on to your right knee, slowly put it in front of your left ankle. Put your left hand on your left knee, slowly push it to the right, and you breathe out first. Take a deep breath in and slowly turn your body to the left side. Shankha asana or Udar Karshan asana. Now, finding center means you have to do it equally on the other side. So here comes, left knee comes in front of your right foot. Right hand comes on the right knee. Push your right knee to the left side. Take a deep breath in. Turn your body to the right side. I feel equally on both sides, and it tells you I'm in the center. Finding center means able to do the postures equally on both sides. On the same context, here I am, I'm in a Sukhasana. I have both the feet under my knees. I sit down and I listen to my body's signal. What is my body's signal? No pain and effortless breathing. What is the effortless breathing means? You will be able to talk. You'll be able to sing during your practice. So the comfort level of the asana is called Sthiram Sukham Asanam. Sthiram, stillness. You are still. What a still means, when the muscle contracts, it puts me in this pose or in this asana. If I progress slowly in stages, the muscle cannot stay contracted too long. Before the muscle starts to relax, it causes a little fasciculation, and you will feel. Suppose you feel pain in this posture, then you back off. Stay in the posture, as I said all the time. Use your hand mudras, touch your index finger and thumb. Close your eyes. Breathe out longer than breathing in. Breathing out is parasympathetic. Breathing in is sympathetic, and this thing is going to happen on its own. Do not push, do not adjust, and slowly you come to the state of sthiram sukham asanam, stillness, happiness in the asana pose. Once you are in that state, now change your foot and do the same asana, crossing the legs in the opposite side. So what we are doing, we are activating both sides of the brain equally to come to the center. Even in the morning, in a daily routine after morning bowel movement, we're going to brush our teeth. And I've been doing it for a while because I've been right-handed all my life. So I brush with my left hand. So the moment I have started brushing my left hand, initially the brush was all over. It never came even close to my mouth. Slowly and slowly, the brush comes to the mouth. I can keep brushing with my left hand very comfortably. But at the time, that's what happens. My right hand starts to move like this, because our brain is neuroplastic. That means it has developed the neuroplasticity, and it's going to do the same thing what it's been doing before. So initially what I used to do, I have my health tracker. Remember, I always used my health tracker during my practice. I used to put my hand behind. Basically, I'm locking down my right hand and I'm brushing with my left hand. So after a while, when the neuroplasticity sets in, neuroplasticity basically means a habit forming. For neuroplasticity generally needs about 30 to 40 input in your brain, but it varies for individual human being. Somebody develops neuroplasticity very early and somebody takes a longer time, but average is about 30 to 40 input. Once the neuroplasticity sets in, I'm feeling comfortable like this. So see, I have gone both sides, and then, as you know, when you bring the relaxation response, it lets you able to get into all different asana poses. So people ask me, I exercise. Why do I need to do yoga? I also exercise, I run in the treadmill, I walk outside, I do little weight training, but I also do every day a daily practice of yoga. Exercise is a muscle contraction. It is a sympathetic overdrive. Heart rate goes high up, blood pressure goes high up, respiratory rate goes high up, your blood sugar is up, the muscle is contracting. But when the body shoots a sympathetic tone very high up, body responds to a homeostasis with a parasympathetic activation. With a parasympathetic activation, heart rate comes down, blood pressure comes down, respiratory rate comes down, and you get the benefit of exercise after a sympathetic overdrive. Yoga practice is an initial relaxation response, initial activation of parasympathetic tone. Here I am, 15-20 minutes this morning session. I already having some saliva in my mouth. My mouth is wet. I have not drank any water since my morning called Ushapan, morning. So when you are relaxed, and the way to achieve, remember the hand connects your body and mind. The hand gesture called mudras. Touch your index finger and thumb. Put it over your knees. Keep your spine straight. That brings you in the center. When you keep your spine straight, you are giving all the back muscles a relaxation. If you're practicing with me, try this. Sitting in a cross-legged position with the spine straight, touching your index finger and thumb. Close your eyes and visualize straight in front of you so your neck is straight, high up. Visualize as if you have been hung from the ceiling. So you get tall and straight. Lung is like a balloon. It has 6-liter capacity. It only needs 1.5 liter to keep it open. 4.5 liter of air can be exchanged. And in the normal respiratory exchange, which is called a tidal volume, we only breathe it in and out 500 cc, like 0.5 liter. 80 to 90% lung function is the result. Breathe out first. Take a long, slow breath in. And completely breathe out slowly and as long as possible. Slowing down your respiratory rate improves your health. In the animal world, the animal which is the rapid respiratory rate, they have a shorter lifespan. Animal who has a very low respiratory rate, they live longer. So if you can do simply 4 seconds out and 2 seconds in, which is a very simple yoga practice, Your breathing rate will drop down normal 15 to 16 to 10 per minute. For us, we have been practicing for so long that we can easily do 8-second in, 16-second out, 10-second in, 20-second out. Our breathing rate can drop down almost 3 or 4 a minute. Brings the relaxation which takes you to the center. So example again, from here, if you progress, is called a perfect pose of Siddhasana. Take your heel all the way to the back, take your foot on the top, and your knees will drop down. So you are not pushing. If you're not pushing, you are not trying to do any adjustment. Relaxation comes from within. In stages, impossible become possible. Opposite side, same asana, finding the center or bringing the center. Perfect pose, Siddhasana. You will see your one side is more comfortable than the other side. The comfortable side means you have been practicing it for a longer time. So for your conscious practice, what you are doing now will be doing a little longer for the side which is uncomfortable for us. Next asana in a stepwise, half lotus, Ardha Padmasana or Swastika asana. Feet high up, knee comes down. Again, listen to your body's signal. If you have any pain, back off. Find a place where you have a comfortable discomfort. Finding center is not that easy. It needs your self-help. Remember, healthcare is self-care. Disease care you can buy. Disease care, you can go to a doctor and you can get the disease care. But health care, you have to earn yourself. You have to earn the health care. So this is taking you to the level of your health. Karo Yog, Raho Nirog. Practice yoga and you will stay healthy and disease free. Same asana, opposite side. You will find the center when your both sides will have a equal feeling and equal discomfort. At a point you will come where you are comfortable, when you are in a sthiram sukham asanam. Putting your hand, separating the toes helps relaxation of the toes. Put my hand, separate my toes. Separation of the toes are called yoga toes. They're all over the market. But all bottom line is just separating your toes. So here I am. This is called Ardha Padmasana or half lotus, and I'm relaxed enough. I'm in the center, so I can go back and get into what is your called a lotus position or a Padmasana. Wonderful yogic asana. We all want to achieve this asana, this practice, and people always say, hey, this looks very difficult. This looks, oh my God, how could do it? No, it is all in relaxation response, all in finding your center. For the finding your center, equally on both sides. Even for me, doing it for a long time, all my centering asanas still are not centered equally. But I'll show you the centering asanas. Okay, so what it was, my right foot was first, then my left foot. So I have to remember. I do it subconsciously many a time. I forget. That's normal in yoga practice. So now what I will be doing, before it was the right foot up first, so left foot is first now. And I'm sitting comfortably, I'm talking to you, I'm chit-chatting, I'm talking, I'm singing, I'm pain-free, I'm effortless in breathing. And in that state, I take the other foot, bring it up, and get into a lotus pose with the opposite. Now I can tell you here, now what is happening, when I did that, I just wanted to show you this, very important. I did that, I felt a little discomfort on this muscle. So even I'm doing it for a long time, I just wanted to show it to you. If you're practicing with me, this thing will happen to you. This thing happened to all of us. So listening to your body's signal, you back off. Okay? Now, if you feel that this discomfort is slowly disappearing, you can try it slowly. Just get high up, one step at a time. Here it is. Close your eyes. Have your meditation mudra, dhyana mudra or jnana mudra. Keep your spine straight. Breathe out longer than breathing in. Maybe count of 3 in, count of 6 out, count of 4 in, count of 8 out. And you can come slowly and again listen to your body. Now I don't have that feeling anymore. Okay? But just wanted to show you that this will happen to you. The moment you listen to your body, you will come to the center. The moment you come to the center, you will have this is free, medication free. quality of life and living. If you have a lifestyle-related chronic diseases, you will have a better management of the disease. You will have a less progression of the chronic disease. Some cases even you may have a complete recovery from the chronic disease. You will definitely have a reduction of your pharmaceutical support. If you have a diabetes, if you're taking diabetic medication, if you have a coronary artery disease, you're taking the coronary artery medication, aspirin, statin, beta blocker, ACE inhibitor, we'll be able to tell you your pharmaceutical support will be reduced slowly and slowly. This is the part of integrative medicine. And this will be done by your doctor. If you have high blood pressure, you're on a blood pressure medication, you are going for a checkup every 6 months or every year, the doctor says, you know, your blood pressure is good. Even I have recorded it, even you have recorded it. Okay, so let me cut down a little bit of a medication. A reduction of the pharmaceutical support for the chronic lifestyle-related disorders is the outcome of regular and daily yoga practice by activation of the relaxation response and a parasympathetic tone. And we as a physician, we can talk about it all the time because we have a health parameter. And we are recording every health parameter when we are practicing yoga daily. Here it is. I can even do a EKG. This is the Apple Watch. I'm getting a 30-second EKG. Perfect EKG and a perfect heart rate. This EKG in the Apple Watch or any other health tracker will pick up atrial fibrillation, bradycardia, and tachycardia. It is not going to pick up your ST segment changes, any sign of myocardial ischemia. It will show your heart rate, it will show any rhythm abnormality. Say, bringing center again. Say if you do a this is Dandasana. And always remember that when you keep your spine straight, you give a relaxation to the paraspinal muscles. The moment you give the relaxation to the paraspinal muscles in the midline, you get into the center. Put my hands on both sides. Keep your spine straight high up. Initially started with the toes. Breathe in, breathe out. Separation of the toes are extremely, extremely important practice in yoga. When you're able to separate your toes effortlessly, pain in the foot goes away. Foot function gets better. It's a relaxation response. Your ankle get relaxed. You can comfortably move your feet. Dandasana. So, maintaining the structural integrity in the midline, also finding center. So we do all our spinal flexibility. Flexibility of our body is health. Rigidity is disease. And always I make a fun and make a joke. Our ultimate rigidity is rigor mortis. When you die, our whole body is rigid. Okay? Spinal twist. Okay. You put your right foot against your left thigh. Left hand comes outside your right knee. Right foot, right hand goes to the back. Left hand will be up here. Slowly come down outside the left knee. Breathe out first. Take a deep breath in. Slowly turn your body away from you. And now you pay attention to your breath. And you're practicing with me. Push a little bit more. You will see a spot when you will not be able to talk, not be able to breathe effortlessly. That is the point, that you stay there between 5 to 10 breaths. When you're there between 5 to 10 breaths, again, all the yogic breathing starts with a breathing out, then slow, long inhalation, and slow, longer exhalation, longer than inhalation. And eventually you will see more and more you are relaxed. The breath will be more and more deeper. So finding center means balancing to the opposite side. Left foot comes close to your right thigh. Right hand goes outside your left knee. Left hand goes to the back, and the hand touches outer side of your right knee. Same phenomena. Breathe out first. Take a deep breath in. Slowly turn your body to the left side. You'll find a position where you will not be able to talk, not be able to breathe properly. Stay here between 5 to 10 breaths and slowly come back to your Dandasana. When you get into the center, when you get into the relaxation, your breath becomes effortless. Your breathing through both the nostril becomes equal. So showing it a few more, centering asanas, Vaisasana. Vaisa means your buffalo or cow. If you see that it is the beginning of Gomukhasana, called a cow face, one foot on the top of the other foot. If you see a cow or a buffalo, when they sit down, they will cross their the two front legs like this. In fact, this is so comforting, so relaxing that you will develop a tremendous amount of neuroplasticity, and you will have this asana subconsciously. What does it mean? Personally, we can tell you that we have a lot of experience sitting in a chair. Both the feet are down. Suddenly, we see our feet is like this posture, even I'm sitting in the chair. Sitting in a sofa, feet goes up, sits like this, because it's a tremendous amount of relaxation response. Look at the relaxation of a major part of your body. Our body whole works as a whole. It is not a Western reductionist concept that I can relax my gluteus maximus. I can relax my calf muscles, gastrocnemius. Your whole body works together. So same thing, bringing the center means you can able to do it equally on both sides. Now, the right knee is in the top of the left knee. Before it was left knee in the top of the right knee. Metaphorically, this looks like a face of a cow. So this is called your Gomukhasana, cow face. So see now, we are relaxed equally and both the lower side. Now we want to incorporate in your upper part of the body. That is your Gomukhasana. So let me turn around in the same posture, turn around. What we're going to do in a Gomukhasana cow face, right knee, the right hand will go high up, left hand will come in the middle. Generally, we put the left hand in the middle, right hand will come down, it will touch it, hook it, will essentially, we handshake each other. So looking from the back, what it will look like. So which knee was on the top? Was the right knee. Okay. Right knee was on the top. Okay. My right knee was on the top. Right hand goes high up. Left hand, I just put it in the middle. Right hand comes down, touch it, hook it. Essentially, can handshake each other. I'm comfortable, I'm talking, I'm breathing, I'm effortless in this posture of a profound relaxation of the both upper and lower part of the body. Again, always try to be in the posture between 5 to 10 breaths. If you stay in one asana in 5 to 10 breaths, the neuroplasticity will set in. Now I'm doing the opposite side. Now my left knee is in the top of my right knee. I close my eyes, keep my spine straight, do a few rounds of breathing, exhalation longer than inhalation. My left hand goes high up. Right hand comes into the middle. Stabilize right hand in the middle. Left hand will come down and touch it, hook it. Essentially, will handshake each other. Now you notice that both sides equally have done. When you don't find the center, your one side will be more comfortable than the other side. One side you'll be able to connect both the hands, and other side you won't be able to even come close to both the hands. Gomukhasana, done equally on both sides and finding the center. Do the same thing when you're standing up. Able to balance between both the sides equally and in a balancing pose. So let's see a couple of bringing equal and centering the position. From a sitting down squatting pose called Malasana, it is so comforting, so relaxing. Once you have this neuroplasticity sets in, you like to sit down in this posture as long as you can. For me, probably, I'll be able to sit down in this posture the whole day. And then you can get up without a support. When you get up without a support, bring the balance, bring the centering. I'm comfortable standing like this. I'm comfortable standing like this. In my practice, I bring both the feet together. When you fall down, you always put your hand first. Hand keeps your balance. That's the reason when the people are falling, they fall in the outstretched hand and they develop what is called your Colles fracture. Colles fracture is a fracture of your wrist from an outstretched hand. So put your hands to the back and do a like called prayer pose to the back. So this is the prayer pose to the back. Put your hands together and in a prayer pose to the back, you are relaxing the whole upper part of the body. And again, knowing the yoga practice, it does not relax a part of the body, it relaxes your whole body and mind. I'm right-handed, right-footed. The first practice will be, see if I can stand on my left foot. I can stand on my left foot 10 seconds, 20 seconds, 40 seconds. Then I made one almost impossible practice initially, closing your eyes and see if you can able to do it. Closing your eyes and able to, I've been doing it for a long time. I still not comfortable, but this is the sign of your health. Able to stay on one foot with your eyes closed. Now on my right foot, and I can clearly tell you I'm more comfortable standing on the right foot than the left foot. My centering has not arrived yet on my balancing postures. Close my eyes and see how long I can stay in a balancing pose with closing my eyes. Same way, you can do the equally balancing poses like your tree pose or brickasana. One foot on the top, below your knee, above your knee, and when your hand is to the back in a prayer pose, you will feel, it feels a lot different than putting your hands in the front and in the top. Same thing you do. Try to put it below the knee or above the knee. Don't put it at the level of the knee. It's wonderful practice. Then to progress a little bit more, what you can do, you can bring your feet high up slowly and stay in this posture as long as your body and mind will let you. Centering your mind through centering meditation, through centering pranayama is a Wonderful practice. Other side. The foot high up. Sorry. Bring it high up. Next is a wonderful centering practice is your sit, rise test. And I've shown it to you. You can always go and sit down in a squatting pose and get up without a support. Bring the balance and the centering now. We have been practicing for a long, long time with our participants. And wherever I go, somebody from our group will show this thing to everybody. Cross your feet. Cross your feet and see if you can sit down, crossing your feet and getting up without a support. To the opposite side. Cross your feet to the opposite side. Sit down, crossing your feet and getting up without a support. Excuse me. When you have this relaxation of your body and mind, you also have a relaxation of your gastrointestinal tract. Yoga practices we have noticed as our experience-wise, people do belch, people do release some gas from the lower part, but it's entirely normal. It's a sign of a relaxation. We don't practice pranayama standing up, but a Kapalbhati pranayama tells you that you are very relaxed. So if you put your hands again together, this one you can do call a closed hand posture. Use your right hand, hold your left arm, and left hand your right arm. We can clearly see our breath becomes effortless with all these relaxing postures. Now we'll be seeing here, I'm doing a very gentle Kapalbhati pranayama. And during Kapalbhati pranayama, I'm doing a balancing poses. You can't beat this practice. We call this money back guarantee. By the time you are able to do this kind of practices, you'll see your blood pressure will come down, blood sugar will come down, your cardiac function will improve because of your coronary vasodilation. So these are the practices for centering, finding center. That means trying to find a balanced body, mind, and spirit. Today was this asana practices. We have shown to you how to bring the centering, how to become equal on both sides, and next day we'll get into the centering pranayama and the meditation practice. You will see even a ujjayi pranayama as a tremendous centering results. When you do ujjayi pranayama, you do get some cough because it acting in the larynx, slow contraction of the larynx, where the vocal cord is located when the cough reflex originates. So let's finish our practice today. And since we are doing all the relaxing and you can see the heart rate now, the 54, it is 52 now. I don't know if you can, how to show it to you. What does it say? I don't know where it, anyway, I cannot show it to you. Okay. Anyway, so hope you enjoyed the session. This is to let you know that with a daily practice, you incorporate the balancing poses, equal poses on both sides, bringing to the center. Next week, we'll bring the yoga therapy, finding the center through pranayama and centering meditation. If you have any question, any comment, please send it to my Facebook page and I'll be glad to answer for you. Thank you for joining.